Hello viewers, it's a pleasure to meet you. I am Dr. Miriam Laker Oketta, one of the contributors of the Leadership magazine in Uganda. This is a review of the Leadership magazine. The Leadership magazine, for those of you who might not know, is the longest running magazine in Uganda. And interestingly, I was speaking to someone at UCTV a few minutes ago, and he reminded me that next year we will be celebrating 70 years or 60 years actually of the Leadership magazine. Is it 60 or 70? It's around that. Keep tuned and you'll find out later. I'm the health contributor of the Leadership magazine, and like I said, for 21 years I have addressed multiple topics on health of interest to our readers. Because of time, I will zero down to only two topics today. The first one is something I wrote recently, probably the most recent magazine, on the myths around health. And one would wonder why I would bother to do that. As a medical doctor, over the years, I have seen more and more engagement in myths around health, whether it is how diseases are caused or how diseases are treated. And I will go through some of the very basic ones. One of the things you'll find on the internet, and even in the most rural parts of Africa and the world indeed, is that people should not drink very cold water or very hot water. Why? Because we claim that when we drink very cold water out of the fridge, by the time it gets into our stomachs, it will still be really cold and it will freeze the foods that we have in there. But I want to tell you that is a categorical lie. The way God designed the human body is that it works like a thermostat. It determines the temperature of anything that we take into our bodies. So for instance, if you're taking water and it is too cold, your mouth will not accept you to drink it right from your lips. Give it a try. Put ice on your lips and tell me how that feels. And if your body allows you to swallow it, then the distance between your throat to the stomach is enough for your body to change the temperature of that water from cold to around 35 degrees Celsius, which is the normal body temperature. So by the time that water gets to your stomach, my brothers, my sisters, it will be the right temperature for whatever it is in your stomach. Same goes for hot water. If it's too hot, whether it's water or tea, if it's too hot, you will not be able to take it even beyond your lips. But if your body allows you, and by the time it reaches your stomach, the temperature will be normal. The other thing I want to address is the term detox. You hear it everywhere. What does detox mean? Detox actually means one, D means to remove something, and tox is from the word toxins. In other words, the word detox is in full detoxify. So what we're trying to say is that removing toxins from the body. This is also a huge myth. The way, again, God created our bodies allows the body to detoxify itself as necessary. The kidneys, my friends, is the biggest detoxifying organ in the body and probably works better than any other detoxifying mechanism in the world. It makes sure that any toxins that gets into your body is removed from the bloodstream before it even circulates around your body, if it's coming through your mouth. But if it's coming through your blood vessels, for instance, if it was put in your veins, the liver also gets it out of the system. Now, people who preach detox tell you to take certain drinks or certain foods or to stop eating certain things to make sure that you detoxify your body. But these things that you drink or eat are usually not detoxifying agents. How do you detoxify your body? First of all, think about what you eat. For instance, alcohol is one of the most toxic things that we take into our body. Yes, it's full of carbohydrates, therefore gives us a lot of energy because of the sugar and everything, but it is toxic. So what you need to do is reduce the amount of alcohol you take. Another toxin is smoke, and smoke usually comes from cigarettes or from weed. A lot of young people these days smoke weed. So instead of drinking something else to help your body detoxify, just stop taking these things into your body, allow your liver to be healthy, and the liver will do the detoxifying. As we get older, our joints get weaker. Guess what we're doing? We're eating a lot of molokony. For non-HSOT speakers or people who are not from Uganda, those are the hooves of cows. People claim, at least in Uganda, that if you eat a lot of cow's hooves, it's very good for your joints. But that is a lie. Sorry, it is a lie. It's full of protein, it's full of fat, it's full of gelatin, and therefore it is delicious. Take it just for your health, but it's not going to do anything for your joints. So if you're having issues with your joints, if it's because of overweight, work on reducing your weight. If it's because of something else, maybe related to age or sports, please go and see an orthopedic doctor and they'll advise you on how to look after your joints. I'm going to move to another topic. This topic is about cancer, but cancer is a very broad topic. I will zero down to cancer of the breast because we are in October, the pink month, and in October we think about breast cancer. I'll start with a very simple question. What is the breast? We all know what the breast is. But I want to stop at this point and tell guys, please listen, because not only women have breasts. If you're a man, look at your chest. Those two dots there, those are actually breasts as well. So when we are talking about breast cancer, we talk both to men and to women. Let me start with the men because it's more dangerous. So breast cancer in men is usually more aggressive. Why? Because unlike women, the breasts of men have very little to no fat. So when a woman gets breast cancer, before it spreads to other parts of her body, it starts usually attacking like the tissues, the fat in her breast. While the man doesn't have that privilege of having fat, the cancer will move straight and become more invasive, as we call it in medicine, to the rest of the body. So when I talk about breast cancer, please listen, men as well. So what is cancer? Cancer happens when cells in the body grow abnormally. This happens all the time, 24/7, because our bodies are regenerating cells at a very rapid pace. Believe me, the cells that are in your mouth and in your intestines right now, as we speak, will not be the same cells tomorrow because new cells would have been generated. So that is how quickly our bodies generate cells. Now, as you know, if you do anything very quickly, there is a chance that there is going to be a mistake. And that's exactly what happens. Some of these cells form abnormally. And when they form abnormally, we have what we call a tumor regulatory system. We have a system in our bodies that looks out for abnormal cells and immediately kills them. But guess what? Sometimes these abnormal cells may evade this system. And as a result of that, they're given a space in your body and they begin to multiply. And they multiply uncontrolled and they attack other tissues around the cell itself. So this is what happens in breast cancer as well. It might happen within the ducts. In a woman's breast, you have what we call milk ducts. There are tubes that allow milk to move from where they're produced to the baby. Or they may happen in the place where the milk is formed. Those are called the lobules, or any other part of the breast. Now, when that happens uncontrollably, breast cancer has started. It will develop in there, and then it will move into what we call the lymph vessels. The entire human body is connected in multiple ways. 1, the blood system, 2, the nervous system, but 3, the lymphatic system. The lymphatic system's purpose is to prevent and protect us from infection and disease. Now, when you have cancer, what happens is that the cancer cells begin to travel through the lymphatic system and end up in the lymph nodes. For those who might want more science, I'll just explain briefly. When you get a wound, usually you feel pain in a part that is farther away from the wound. Like it might be in your neck, it might be in your armpit, it might be in your groin. That is because your lymphatic system is responding to that injury or infection. So that is the same path that these abnormal cells go through and end up spreading cancer throughout our bodies. So what can we do to prevent breast cancer? Preventing breast cancer is really difficult. The only thing I would say you could do to prevent breast cancer is making sure that after menopause, and most women reach menopause around the age of 50 to 55, meaning their periods stop, make sure your weight is within normal range. If you're overweight or obese, then your risk for cancer in that age group is increased. Everything else is not preventable because age is one of the risk factors for breast cancer. The older you get, the higher the risk, which is the same with every cancer. So you can prevent that by dying younger, which we all don't want to do. The other thing is genetics. So if you have a family member who has had breast cancer before, your risk for breast cancer is also high. So you just need to look out. And people with Jewish origin also have a high risk. But what we can do is make sure we catch breast cancer early. How do we do that? The first thing I would advise every woman to do is a monthly self-examination of your breast and of your armpits. Again, the armpits because the lymph nodes go from the breast to the armpit. So on a monthly basis, about a week after your menstrual period, lie down on a comfortable place, put your hand under behind your head and feel your breast starting from the center going outwards, and then do that to your armpit as well. Do it both to the left and to the right. If you feel anything that wasn't there before, please go to a doctor. For men, do the same as well. Men, you don't have periods, so you can check anytime that you want to check. But if you find anything abnormal, please see a doctor. Also look out for the skin over the breast. If it is hot, or it's feeling painful, or it's feeling hard, or it looks like an orange, there's a term we call peau d'orange, which means an orange peel. So if it looks like an orange peel, if there's any discharge, if the nipple looks like it's going inwards, that is information for you to go to a doctor. Have a breast scan, which could be an ultrasound scan, or a mammography, which is an x-ray for the breast. Because our time is up, this is all I'm going to share today, but please subscribe to the Leadership Magazine and learn so much more about your health. Thank you very much for listening and for watching. God bless you.
That's a wrap.
Okay, great.